Welcome to Health Diary. My name is Gladys Gashanja, and today we're coming to you from the 4 Points by Sheraton here in Hallingham. Now, today I'd like us to delve into what most people would call a taboo subject: hypersexuality. Yes, there is a condition such as that, and unfortunately, due to the misinformation around it, it fuels a lot of stigma, even patients being labeled sexual deviants. So today, we talk about what hypersexuality is and how you can be of more support to those that live this reality. Let's start off with the fact of the matter. Hypersexuality disorder, also referred to as compulsive sexual behavior, is an excessive preoccupation with sexual fantasies, urges, or behaviors that are difficult to control. A person can be obsessed by sexual experiences like masturbation, cybersex, multiple sexual partners, use of pornography, or paying for sex. One is considered to suffer from compulsive sexual behavior when it takes over their lives, is disruptive or harmful to them or others. Left untreated, it can damage your self-esteem, relationships, career, health, and other people.
It started with the emptiness that I would feel after some sexual experiences. And it was an emptiness, but there was also sometimes a regret. Like, I would hook up with someone and then the next day look at them and just be like, I don't even know why I did this, because I didn't enjoy the experience. That was the major thing that was like, oh, okay, I think I need to look into this. I've been someone who has been very vocal about sex online, but in this context, healthy sex. But before then, I was talking about sex, and so for some reason that would draw people to me. I think for me, the major thing was realizing that a lot of times, even though I didn't want to engage with them, I would find myself almost compulsively engaging with them. Then it's like, but why am I giving in, you know? Because for me, the issue was I wasn't addressing the pain, the emotional pain that I was in. I wasn't addressing the trauma that I had been experiencing. And at the same time, instead of validating myself and discovering ways to love myself, I was looking for other people to validate me. In the same way that I knew I had depression was the same way I knew that I was hypersexual. It was looking at my behavior and reading about it and being like, wow, this is actually sounding like me. It usually is a symptom of something, whether that's a mental disorder such as bipolar or unresolved pain, trauma. Like, usually there's something attached. It's sort of like what we're realizing now with addiction, that the issue is not addiction. It's the thing that is feeding the addiction, which is usually trauma. So when that was resolved, the hypersexuality, and help doesn't have to be immediately going to like therapy or you know, going to see a psychologist, because I think sometimes that tends to intimidate people. But reaching out even to your support system first, finding just one person who you can share this with, and research, like read about it. Knowledge would really help you get out of your head about it and take away some of the stigma and judgment that you might have.
So the conversation is hypersexuality. To help us along with the same is Dr. Joachim Osur, who is a sexologist and also the Vice Chancellor of the AMREF International University. Thank you for coming through. And of course, Eric Onyango, who is a mental health advocate and also a poet. Gentlemen, I'm glad you joined me on this conversation because it's one that elicits a lot of curiosity. Now, Dr. I'll start with you. Let's first define hypersexuality, also referred to as compulsive sexual behavior.
Yeah, so hypersexuality is very difficult to define. Let me start by saying that, because professionals have been struggling to really define what is abnormal and what is normal. And up to now, there is no clear agreement. But that said, it is a disorder of desire everyone desires to have sex. So there are those who have low desire, there are those who have normal desire or acceptable desire, and there are those who have very high desire. And hypersexuality is taken to be more than normal sexual desire.
The definition of compulsive is resulting from an irresistible urge. Going by this, would you classify hypersexuality as an addiction?
Those two names have been used interchangeably, hypersexuality and sex addiction, based on the psychiatric definition of addiction being something that you are unable to control, that you are compelled to do.
Let's first off start with the connection between hypersexuality perhaps with mental illness?
In the mental health arena, hypersexuality has been recognized as an issue, but currently they have not classified it as a mental illness. But in the sexual medicine area, we know that there are people who have higher sexual drives than others, and some bordering on abnormalities, which we then call hypersexuality.
All right, interesting. So let's hear from Eric. So when did you find out that you were dealing with hypersexuality?
I was going through therapy for my post-traumatic stress, and I realized that there was a time in my life when I was having sex more than it was normal for me, right? And later coming to realize that it was a response to something else that had happened to me when I was a little younger, being that I was sexually abused when I was about 20 years old. And later starting to have really risky sex where I wasn't even caring about my own health or the health of my partners.
Apart from engaging in risky sex, how else did it manifest?
Sometimes I would abscond school, yeah, and it got to a place where after you have sex, you're thinking of the next time it's going to happen. So this thing sort of still occupies a lot of your time.
Dr. Have you come across patients who, in his case it was PTSD, that have no underlying mental illness and they're dealing with those symptoms?
Majority are actually people who cannot trace it to anything. And let me say there are many people out there with hypersexuality. It is estimated that 5% of the population have hypersexuality. So if Kenya has a population of about 50 million, yes, then we are talking of about 2.5 million Kenyans. Well, if you remove children, maybe we are talking of about 1 million Kenyans having hypersexuality.
He talks about PTSD, mental illnesses, other risk factors?
Many times it's what we call in medicine idiopathic. We don't know the cause. It just happens. And most people don't even know that they have a problem. So they will not come to a hospital.
Now, he talks about it stopping him from even doing his day-to-day, where he would compulsively think about the next time it will happen. Describe somebody who's dealing with hypersexuality.
Their minds, their thoughts are full of sexual thoughts, imaginations of sex. They have a lot of drive to actualize those thoughts and imaginations. They spend a lot of their time and resources on that. So you could be having two professionals, same qualifications, same salary, one investing a lot in their children and family and assets, another one spending their money planning and executing sexual practices. So they will watch porn, they will do phone sex, cyber sex, they will have sex with multiple people. Many times they don't want to do it, but they find themselves doing it again and again and again. They feel guilty about it. They have no sexual attachment to the people they are having sex with. And because they feel helpless, then self-esteem also goes down. They feel frustrated. And many times they can then end up with other psychiatric problems like depression and so on.
Eric, does any of that sound familiar?
Well, it does. Well, because, you know, I think it's harder being a man in that kind of environment because compulsive sexual behavior is almost celebrated amongst men. Because, I mean, you're told that the more women you sleep with, the more much of a man you are, and stuff like that. But I think I realized that I was sort of out of order at some point because it wasn't exciting anymore. And I think for me, actually, what helped me is I actually got into a relationship.
So what about the relationship perhaps helped you rein it in?
One of the things that I was really looking for was connection. Yeah. And I didn't have it for most of my childhood. Okay. And so I think just having sex with multiple partners those early years, on one side, you're confused whether it's just experimenting or you're reacting to something. And on the other side, whether you just want to feel good. But for me, I came to know that it was actually more about connection than just merely having sex.
Okay, so Dr. Eric mentions that he has a history of sexual abuse. Have you seen this in your line of duty?
Because of that traumatic experience, it's like what Eric calls post-traumatic stress disorder. And so some of them end up, it can go either way. Some of them end up just, losing that control of their sexuality and having sex everywhere with anyone, anyhow. Others stop having sex altogether. They don't want it.
Now, still on the risk factors, ease of access to sexual content. We are living in a liberal digital world. Have you seen perhaps this spike, the number of patients that come through your doors?
Not really. I think someone with hypersexuality or an underlying sexual disorder will even buy. If you don't make it free, they will buy it. They will go for it, whether it is there or not, just because they need to release the pressure.
There's the secrecy that comes with, hypersexuality. Did that also stop you from finding out or just sharing with somebody what you were dealing with?
Of course. I mean, nobody knew what I was going through. Nobody knew what I was doing. In fact, those years I was doing my A-level in Uganda. And I was studying in a staunchly Christian school. So in school, I'm a very good, respectable boy. But in the streets, it was another thing altogether. So, and it was so bad to the point that, when we'd open school, I wouldn't go to school with everybody else. Okay, I'd book a room in Kampala, go buy sex, and sometimes it was as bad as sleeping with like 3 women in a night. When we'd close school, I wouldn't go home with everybody else. I'd spend one more night in Kampala. So I never talked about it really until when I started going for therapy, which was as a result of depression.
All right. Sounds familiar, Dr.
Yeah, and I must congratulate this gentleman because there are a number of people suffering out there. They won't talk about it. Well, maybe because socially they would face a lot of problems. I've seen church leaders who are sex addicted. So they sneak in the night, have sex with prostitutes. The next day they are in church preaching. If they came out, that church collapses. I've seen married men who are, they leave home in the morning, they pass through a brothel, they have sex in the office at lunchtime, then they go home in the evening. If the wife knew, that family is destroyed. So most people will not talk about it.
Very well said. And I'm sure at this point you're asking, can this be corrected? Hypersexuality, that is. We'll find out in a moment. Welcome back to Health Diary. My name is Gladys Gashanja. The conversation, hypersexuality. Helping us along, Dr. Joachim Osur, who is a sexologist, and of course, Eric Onyango, who is a mental health advocate. And Dr. there is a question that I am very curious to find out what the answer is. Do you see this more in men than women, or?
Yeah, men are more affected than women. The statistics show that because it's a very secretive problem, about 5 to 10% of men may suffer hypersexuality at one point or another. And between 3 and about 5% of women would have the problem at one point or another. Like the last case of a woman I had, I asked her, so how many sex partners have you had in the last 1 month? She said maybe 12, 15. She was not even sure. And the thing with it is that there was no emotional connection. It was for the moment, and it was okay. And then the next day you look for another one. So it happens in men and women as well, although it is more common in men.
And there's also the comorbidities, if you would call it that, the alcohol use for some people to just numb this feeling. Do you see that a lot?
We have seen a lot more people who are hypersexual ending up as drug users as well, and using more alcohol than the other people in the population. And so the tendency to also be addicted to other drugs, alcohol, is common among the population that are hypersexual. Their tendency to slide into depression, into anxiety is also higher.
And is there a certain age group you see hypersexuality more common in?
So it tends to be commoner the younger the person is. This is how it happens. Someone will be hypersexual, they will never realize it, they will do all those things we've talked about. Then at around the age of 40, they start to realize that things are not working. They may even go into other sexual problems like erectile dysfunction or sexual pain because the body is not coping. So they start looking for help. So you'll find that most people come for help later, and so the numbers may start going down. At the age of 35, going to 40, they start realizing, I need help.
For you, Eric, did you ever join the dots that perhaps the depression was as a result of the hypersexuality?
Doctors call it complex PTSD, complex post-traumatic stress response or disorder. That is like having experienced multiple layers of trauma. And for me, on top of the sexual trauma, there was the childhood trauma, okay? And the trauma of just growing up in very chaotic places, all right? And for me, even with the sex, it was, partly also because I didn't have people to talk to. It was really, really hard to express myself, and I lived with a lot of anxiety and fear, okay? So when you're meeting a stranger, there is some sense of freedom that you feel you have because these people don't know you, you may never see them ever again. And that's the reason you keep going for it. I think also, again, it was a thing about connection for me. So when I started gaining friendships and networks and connections and relationships that were healthy for me, then it really just faded away as well.
And Dr. earlier you were mentioning hypersexuality is just a symptom of something else that could be going on. What else do you see?
There are cases where maybe there is a hormone problem. You talked about testosterone. In that case, we don't even call it hypersexuality. It is high testosterone, which needs to be treated. And there are other hormone problems that can lead to that. Occasionally, it is what we call intimacy disorders, which borders on psychiatric problems also, that you cannot, for example, connect emotionally to people, and you need help with that. By the way, we only talk of hypersexuality when we've evaluated other medical problems and we can't put a finger on any.
All right. And Eric, they say the hypersexuality feels like fun at the moment, but when you're done with every episode, it brings on other negative feelings.
That depends, because sometimes you could be so detached from yourself that you don't even care anymore.
So I came across loneliness, escapism, feelings of guilt. Any of this ring a bell for you?
There is a certain level of guilt that, yeah, does come sometime because we've been introduced to sex as this secretive thing that should be happening in the bedroom at night with married people only. Yeah. So I think it's the relationship we have with sex first before the guilt that comes after you feel like you get yourself in a situation where you're hypersexual.
Sometimes it is the spouse who says, there is something not normal with you. Now, when they get that insight, then all those things start coming. The guilt, the helplessness, even psychiatric problems like depression may start coming in.
And even as we're talking about stigma, health practitioners have also been accused of not recognizing the symptoms of hypersexuality and actually labeling somebody as a sexual deviant.
Right now, actually in Africa, maybe in South Africa, Tunisia, you may have an institution that trains health workers in sexual medicine and sexology. Now, most of the people we have therefore, as doctors, nurses, clinical officers, are not trained in this area. Yeah, so need to train even the health workers and need to recognize some of these problems in health policy. Right now, I don't think in our country we have a policy on sexual medicine. It's not there. We don't put money in it. We don't train anyone. So it's hanging out there, and it is you and your problem.
Now, speaking of treatment, what did that entail now when you started doing therapy and you connected the dots?
Well, for me, it was cognitive behavioral therapy that I went through. And again, I realized this issue so many years after it had sort of faded from my life. So it was just important for me to have knowledge about it because it helped me understand where I was coming from, but also further because I'm a storyteller. I tell stories about mental health and trauma. It would also to assist many other people who are struggling with these issues, but they do not know that they are in it at the moment.
And even as we talk about the treatment, what do you consider when you are figuring out a treatment plan?
The plan should involve helping the patient understand the problem and recognize the impact it has on their lives. The second is to identify if there are any triggers that make one, get this compulsion, and there can be many triggers. And the third then is to go through deep therapy. Ultimately, what we want is someone to have control, to be able to choose the kind of sexual endeavors they want to undertake, not to be a victim of this internal pressure to act, but to say no to some things and choose what is within their values so that they are doing it in a way that they are at peace with themselves. And secondly, that if there is any relationship they create, it's not a physical sexual contact relationship, but it's both. That they have emotional attachment as well in their relationships.
And is all this recognized by insurance companies? Like, is it funded?
Nobody funds sex problems. They think it's not medical. So people come with some of these things which even affect their productivity at the place of work, but the insurance will not pay, whether it is erectile dysfunction or whatever. And many times when we evaluate them medically, it could even be because of a diabetes that has never been discovered, or it could be because of hypertension or some other problem that is really going to even kill them. But the insurance companies, if you take it from the angle of I'm seeing a sexual health expert, they will not pay for it.
Again, taboo topic. All right, so even as we bring this conversation to a close, Eric, coping and support is critical in as far as hypersexuality is concerned, and Daktari has alluded to the same. How do you keep yourself accountable?
It's a very hard question because we don't have enough support systems for sex problems anywhere here. I think I was just lucky I had really good friends who I could talk through about my issues. I would write about them. But many more people are really afraid even to talk to their spouses about it, to talk to their friends about it, I think it's more of an intersectional matter, systemic matter, where many stakeholders need to come together and just create a space where people are not exceedingly afraid of talking about their sex problems.
Daktari, how do we bridge this gap?
There is a lot of hypocrisy when it comes to sexual problems. In the open, we are all fine and happy, but in private, we are all suffering. There is at any given time, I can assure you, 40 to 50% of the population is going through some sexual issue that they don't have an answer to. The sooner we come out of this hypocrisy, the better. And just have policies that will help us to address sexual health problems.
Very well said, Dr. Joachim Osur, sexologist and also the VC of the Amref International University, and Eric Onyango, who is a mental health advocate and a poet. This was a very insightful conversation. Thank you. Time now for a health tip.
There are some foods and drinks that can have harmful effects on your teeth. Most of the dental decay or caries is caused by what we call cariogenic food. Cariogenic food means food that has a lot of sugars and starch. And this is especially for kids. So it is important that they avoid sugary stuff, and if they have to take it, they make sure they brush immediately after taking that. There are other foods like garlic, onions, and some spices. They can make your teeth become stained, and also they can give you bad breath. If you use lemon too much, then it can cause erosion of the teeth, so that you find your teeth are becoming brittle and they start flaking off.
Well, social media is a buzz. Now that we spoke about hypersexuality, remember any of your questions and suggestions, Dr. Rick can help you along with the same. Well, it has been Health Diary. My name is Gladys Kashanja, coming to you from the 4 Points by Sheraton here in Hurlingham. Until next time, see you.